Hey everyone, it's Evan Kirstel on a beautiful Thursday morning here in Boston. Very cold. I have a great guest today, Mark from Roundtrip Health, a company that really impressed me and I wanted to bring to you. Mark, how are you?
Doing well. Thanks for this opportunity.
Well, thanks for joining us. And I was really impressed by your mission and the way you're supporting patients in this very difficult period. In particular, for those who aren't familiar with Round Trip Health, give us the 30,000-foot view of who you are and kind of what Round Trip Health does.
Yeah, really excited to talk about what we're doing, and it's our impact. I mean, it's so neat. Like to it sounds ridiculous. I like leap out of bed on Monday
Oh, that's
mornings.
awesome.
Just
I love
like
that.
I love what we do. So I'm Mark Swiatage. I'm the founder and CEO of Roundtrip, and we are removing transportation as a barrier to wellness. Staying at that 35,000-foot level. What does that mean? So we know that 1 in 5 people in the United States miss or delay their healthcare, with transportation being one of the leading reasons. So when you kind of tease that out, we see that that's largely the vulnerable population, right? Lower socioeconomic, the elderly. And we have created a solution, a platform that allows for health plans, provider organizations to use transportation as a value driver, get folks to their medical appointments, and show the value of those rides to improving health outcomes.
Wow, that's such an important mission. And particularly during the pandemic when all of us are stressed and challenged at our home life and work life balance, social determinants of health have really come to the fore. But before we jump into that, how did you create Round Trip Health? What was the genesis of the company? Where did the idea come from, if I can ask?
Yeah, that's pretty cool. And I also do a lot of mentorship for budding entrepreneurs. So I actually love talking about the story of how we started the company. And really, it's twofold. The first is my own personal background. So uh, I worked in the ambulance industry. So I worked frontline on a patient on a vehicle, providing patient care, transportation services.
Wow, thank you.
Um,
Thank you for what you did.
yeah, it was
Amazing.
awesome. And so I would hold patients' hands while we were taking them to or from a medical appointment. And the patient would say to me, I'm not going to next Tuesday's cancer appointment or dialysis appointment or wound care or what have you. And I remember thinking to myself, if you don't go to next Tuesday's dialysis, there is not going to be a next week, next month. Um, and when talking with those patients, they would say to me, it's not about the actual care that I'm going to receive. By the way, getting like dialysis care, chemo, I mean, these are not easy things to go through. And so for that person to say to me, the ride is harder than the actual care that I'm going to receive, something was wrong. And that was my experience many, many, many times. So I remember having those experiences, and ultimately I followed my passion. And about 6 years ago, uh, took that leap and decided that let's see if we can make something of this. And so I reached out to a bunch of, now I'm getting to the second part of how we started Round Trip. I reached out to a bunch of hospitals, cancer institutes, transportation companies, nurses, social workers, health plans, anybody that I could find and talk to who might interface with patient transportation, and said to them, is there a problem? And if so, what's the solution look like? And from that, I'll never forget one of the senior executives at MD Anderson at their New Jersey location, a big prestigious cancer institute, pulled me down into the lobby of the hospital, and it was probably like 7 o'clock at night. The lobby was full, and she goes, "These are all folks that have had their cancer care waiting to get home." And I
Wow.
go, "Oh my gosh, it's like late. Like, what's going on?" And she's like, "I don't know if they're coming back tomorrow because they are so frustrated with getting home tonight." And then she proceeded to tell me that she would oftentimes like coordinate the rides for folks. So I knew there was something there. And I will encourage folks that are looking to start a tech company, healthcare tech company. I'm a big subscriber to design thinking. We took an entire year, namely 2016, and met with all of those stakeholders that I mentioned, sat beside them, tried to understand, yes, the problem, but what might an opportunity to solve that problem look like, and worked together with them to iterate prototype technology that would remove legacy approaches, phone-based analog modes, and ultimately empowering patients in the transportation process so that we could get them to the betterment of health and well-being.
Amazing. And so your go-to-market is through and with health systems and health plans. Describe how that process works, because they're kind of the key to unlocking this new patient experience you've created. So how does that work?
Yeah, really cool. So where's Roundtrip today? Essentially, like, what does that relationship with a provider organization, like you mentioned, or a health plan look like? So let's start with on the provider side. So Roundtrip, we are a SaaS platform. We are clinically integrated and logistically integrated. So for provider organizations, meaning large health systems like Johns Hopkins University, which is one of our customers, university hospitals in Cleveland. I could go on and on. The Bon Secours Mercy Health System and many more. We clinically integrate. So we integrate right into the Epic environment, the medical record system that these provider organizations are on and using every day. And then those care teams, namely a nurse, a social worker, can access the full spectrum of rides for a population, whether somebody can walk like me. We're able to get them a ride share, meaning Uber or Lyft, but more advanced ride types. The pandemic, for example, we are able to secure rides for COVID positive patients and other patients that need special services during the transport. That's all available through medical transportation companies who are onboarded to our technology, able to complete those rides, up to and including ambulance rides, particularly non-emergency
Wow.
patient transport for folks that need to go with a full crew to and from. And then, yes, those transport companies receive the ride requests. We're logistically integrated as well. So that might be rides that flow right into their routing software. And then those rides are completed by those fleets of transportation companies based on the appropriate acuity and relationship for that population to get that person to and from. And then for the health plan side, this has been really cool. So we started to see that providers are using our organization, our technology. Really, it first started with an efficiency play. How do we get folks out of the hospital? Then we started to see them using rides as a value driver. How do we offer rides to a population so that they're able to make it to their outpatient appointments, like behavioral health or cancer care and what have you, so that they stay active in the community? Recently, over the last, call it 2 years, recently, I guess that's recently in the scope of like healthcare, we started to see an opportunity, particularly with health plans, and kind of double clicking on that, namely Medicare Advantage. There is not enough airtime for a Medicare Advantage conversation. I was just reading the other day that Medicare Advantage, based on 2 outlets, are anticipating the growth in MA will eclipse all US e-commerce by the end of this decade.
Wow.
That's how big Medicare Advantage is growing in the United States. And we are seeing that the opportunity to partner with Medicare Advantage plans to create ride benefits so that populations can get access to, yes, their outpatient appointments, but let's even expand that conversation. What about food insecurities? What about housing insecurities? What about the ability to go to the gym? Stuff like that to keep folks active in the community, use rides as a value driver, keep them out of the hospital. And that's where we're headed with our technology.
Wow, so meaningful. And you must wake up and hear just incredible stories every day about helping patients. Give us a peek into the day-to-day operations and what it's like, managing this network that you built.
Yeah. So let me talk. Actually, you kind of mentioned some of the stories, the anecdotes that we have. So I'll tell you one. We send messages to every rider about their ride, improving a
Mm.
level of engagement that they had. Really, there was no engagement before us. So informing folks about the provision of their rides, reminding them about them, etc. And this includes, like I said, rideshare, wheelchair, stretcher. So people will reply to these automated messages that they're getting. Sometimes I think, like, we're so good. Like, I think they think they're actually talking to somebody, like live texting. But we had somebody that replied to one of our texts, and it basically had me in tears. So we are currently launched in a study with the National Institutes of Health, an organization called Brightview Health in Ohio, and in partnership with Lyft and an academic research partner, the University of Pennsylvania, to understand the impact that transportation can have to, I'll call it the other crisis that we haven't been talking about since the pandemic, which is the opioid crisis.
Oh,
And
wow.
so we are showing that by improving the engagement, namely through texting of populations, getting them access to rides, will they comply with and improve their adherence to treatments for opioid use disorder? So we are sending these messages out to folks, and somebody replied to one of the messages and said, in so many words, that because of the ability to access transportation, I have been sober for the first time in years.
Oh,
I've been
wow.
complying with my appointments, and as a result, life is looking better for me. I was like crying. Like if that doesn't bring it home for why we are doing what we're doing. And so we've shared that across our board and across our team. Like we're very mission driven at Roundtrip, and that again jumps us out of bed, at least me out of bed, to do what we do.
Amazing. And, you're doing such important work. Why would a health system, not partner with you at Roundtrip? Like, what are they doing today? Is it legacy technology? Is it integration? Or is it lack of awareness that you exist? I mean, what are the barriers to, because it's such an incredible offering you built?
I think yes, and yes, everything that you said. And I think there's also like the buyer's journey. I read a lot about that. So folks may have identified that they have transportation struggles, but they're not quite at the time of ready to purchase.
Mhm.
So maybe they are organizing, many of our partners had organized like internal coalitions to study and understand what is the problem with transportation. I was just on a call 2 days ago with a health system, and here's what the buyer's journey was. There was a champion at the hospital system, a very very large hospital system, and she identified transportation was a problem, and so then it became like, anybody else in the health system have this problem? And we got onto the phone call. I think there were 30 people from the hospital side on the call. And so where our conversations then turn is, how do we navigate our champion with so many colleagues that are saying that this is a problem? So I find that to be pretty common. Most of the customers that we work with they all know transportation is a barrier. It is the use case that they're trying to figure out. Is it a problem in the ER with discharges? Is it a problem in outpatient with our primary care appointments? Is it a population health play? Are we looking to address social determinants? So everybody knows transportation is a problem. It's, where do we begin? And then the second thing that I often see with our customers is transportation's table stakes. They know that they are maybe behind in using transportation. Maybe they're still using like taxi voucher programs. Maybe they own a fleet. So they've got a kind of a hodgepodge of approaches, but they don't have the insights to say, this is where we could further fuel an investment in transportation. One of our customers owns a fleet of vehicles, and they're in a very rural location, but they couldn't quite figure out, like, should we buy more vehicles? Should we use community resources in a different way? And so the access to rides through our tech, table stakes, but really it was the insights that we started to offer. We could show utilization. We could show utilization by disease state, by time of day of week, hour. We can tell by ride type, by demographic, by pickup locations. So it allowed for them to say, here's how rides are getting used at our system. Here's where we want to further invest in rides or vehicles for our patients.
Amazing. Yeah, I'm an enterprise IT tech guy by background, and all we talk about is ROI. So, and here you have a clear and very compelling ROI, I imagine, and also in terms of efficiency and workflows, just amazing. And I think you just recently did a big fundraise, which validates a lot of what you're doing, right?
We did. We had I'll call it a rather explosive capital raise that we closed in December. So it's empowering for me to say that to all of the capital partners that are out there that are reaching out. We are heads down focused on execution right now. Feel free to check in with us, and then we will probably circle back, as we continue to progress. But we brought in some amazing partners. We were really prescriptive on the capital partners that we wanted to bring in this current raise. We know that Medicare Advantage is a hot opportunity, and I'm really excited about several of the partnerships that we brought in, capital partners that we brought in, that have a thesis and understanding of non-emergency medical transportation. They have an understanding of benefits, supplemental benefits for Medicare Advantage. And so, like, one of the partners, Nightingale Partners out of Washington, D.C., well built out thesis in Medicare Advantage. We see opportunities to expand with partners like Nations Benefits, where they offer supplemental benefits to health plans across the country. And that is only going to continue to fuel and propel our growth. Our lead investors, the Motley Fool Ventures, many folks may know the
Oh
brand
yeah, sure.
Motley Fool. They have a venture arm. And they have been just wonderful partners for us, and particularly me as a founder and CEO. They have been they allow me to be successful as a CEO, but I feel that I have the resources, a depth of resources through them, that allow for us to understand the metrics, the unit economics of our business, so that we are sustainable. And here I stand today. Our business has been around for 6 years. And yeah, we were running healthcare technology, particularly in the transportation space, in a pandemic, when healthcare shut down and transportation shut down. And it is because of the Motley Fool that I'm able to stand here today and say they helped us navigate those times. And Roundtrip is bigger, stronger than we were pre-pandemic. We've made up for all of that time, and it is because of the capital partners we were able to do it.
Fantastic. Well, such an important mission. Healthcare isn't just about telehealth and telemedicine. You do need to get into see the doctor. And for people who have challenges and others, it's such a great value proposition. So what's next? Onwards and upwards, growth and expansion, more customers, partners, going international. What's on your radar this year?
Yeah, so we're hiring. So I encourage everybody to take a look on our website. I just got out of a meeting right before this, so I was like, oh my gosh, more positions we're going to be posting. So we hired 26 people last year, and gosh, I don't know the count for this year, but we just brought on unbelievable product managers to the organization, unbelievable sales folks to the team. We're diversity led here at Roundtrip. I'm an LGBT founder, so diversity is an important component of who we are. Almost half of our company identifies as female, and that is a thesis that we hold important to who we are. It's our identity. I see us continuing to grow. Certainly in the Medicare Advantage space through supplemental benefits and transportation as a value driver for plans that are particularly mid-market plans that are looking to differentiate themselves in their offerings to recruit members to their population. And that's just so exciting for us.
Absolutely. Well, thanks for spending time with me and the audience, and, follow Roundtrip Health on Twitter, support their mission, and, onwards and upwards. Thank you so much for your time, Mark. Much
Evan,
appreciated.
thank you so much.
Yeah. I'll catch you in the real world at some point. But
looking forward to it.
Until then, take care.